Alright, here we're looking at the heart, and from the anterior portion of the heart we'll notice that right here, this is the apex of the heart, and this is, you can see the four chambers, so the right atrium, the left atrium, the right ventricle, and the left ventricle. Also part of the atriums, you have the auricles, so the right auricle and the left auricle. Between the two ventricles is a wall called the interventricular septum, which right here you have the anterior interventricular artery. Now you can also notice that the ventricles are very muscular, and there's also a layer of fat that is covering them. If we look up top a little bit more, we can see some of the major vessels coming in and out. Superior vena cava, the aortic trunk going into the aortic arch, and the pulmonary trunk. Now if I open up the heart and look at the inside of the wall, we can see the different internal structures. This fibrous looking muscular tissue on the inside of the chamber of the ventricles is called pectinate muscle, and these muscular projections are papillary muscles. Papillary muscles are attached to chordae tendineae, which hold the flaps of the bicuspid and the tricuspid valve downwards so that they don't invert. This is the right ventricle, which goes into the pulmonary semilunar valve and then into the pulmonary trunk. If we look at the rest of the model of the heart, we're looking at, again, the right atrium. Now the right atrium takes blood from the superior vena cava, the inferior vena cava down there, and also from the opening of the coronary sinus, which is right here. Also in the right atrium you can see very well the fossa ovale, which is just an indentation, which in the fetal heart was the foramen ovale, which was a hole between the left and right atrium. Now the right side of the heart, here's the tricuspid valve, which has three flaps going into the right ventricle. Again, the pectinate muscle along the wall, papillary muscle, and the chordae tendineae. Between the two ventricles you have the interventricular septum, the wall, and again, pectinate muscle, papillary muscle, and chordae tendineae. The left ventricle goes into the aortic semilunar valve, up the aortic trunk into the aortic arch. Here is the left atrium, and you can see the four openings for the four pulmonary veins. Now if we turn the heart around and look at it from this angle, when you look at the heart from the back like this, that is known as the base of the heart. From here I'm going to put the heart down and look at some of the structures on the posterior aspect. This is the right atrium, inferior vena cava, left atrium, and here are some of the pulmonary veins. The other two are right here, 1 and 2. Left atrium, this large vein on the back of the heart is the coronary sinus. This collects all of the blood from the heart tissue itself. It drains into the coronary sinus and then eventually into the right atrium. This again is the left ventricle and the left atrium. Back here we can see this is the trachea. A model of the trachea is connected to this heart. And right here we have the aortic arch, which is the large red vessel, and below that is the left pulmonary artery. Now the aortic arch. The aortic arch has three branches coming off the top. The first one is the brachiocephalic trunk. The middle one is the left common carotid, and the third one is the left subclavian artery. The brachiocephalic trunk then branches into the right common carotid, which goes into the head, and the right subclavian. Subclavians go under the clavicle and into the arms. Right here is the pulmonary trunk, and this is the left pulmonary artery, which goes to the lungs. You can again see the trachea connected behind the vessels here, and on this side we can also see the pulmonary arteries, and it looks like another branch of the pulmonary arteries. One more quick thing to mention is that right off of the aorta you have these two little branches. Those are the right and left coronary arteries which supply blood to the heart. Real quick, again, I just mentioned the left and right coronary arteries. This is a branch, this is the right coronary artery, and this right here is the left coronary artery, which branches into the left circumflex artery, and one that goes down the interventricular septum, which is the anterior interventricular artery, coronary artery. Okay, this model we're just going to look at the veins. This is the superior vena cava. Now the superior vena cava takes blood back from the head and the arms. These portions right here are called the brachiocephalic veins. They take blood from both the internal jugular and the right subclavian vein. Internal jugular vein, right subclavian vein, right brachiocephalic vein. On the left brachiocephalic vein you have again the internal jugular and a branch into the left subclavian vein. You can also see the aortic arch and the three branches off the aortic arch. You have the first one, brachiocephalic trunk, the left common carotid, and the left subclavian artery. This brachiocephalic trunk, if you turn it this way, again branches into the right common carotid and the right subclavian. So these are both subclavian, artery, and vein. If you look at this model from this side, you can also see some of the other structures attached to it. This is the trachea and the esophagus. The trachea has these rings on it, and that's how you know it's the trachea. And the esophagus is just a long, smooth tube. From this side, we can also see the different chambers of the heart. Right atrium, right ventricle, left atrium. The left ventricle goes into the aortic semilunar valve of the aortic trunk, the aortic arch, and then down the thoracic aorta, which would be this part. The left atrium here has the pulmonary veins coming into it. And on this side of the heart, the inferior vena cava would come up here. Again, you have the right pulmonary veins right here, and then the right pulmonary artery. This is again the trachea with the rings and the esophagus. Again, on this model you can see the tricuspid valve with the chordae tendineae, papillary muscles, and the pectinate muscle. On the left ventricle you have the papillary muscle, chordae tendineae, and the bicuspid valve, the aortic semilunar valve, the aortic trunk, the aortic arch. On this model we can see another important structure, and that would be the vagus nerve. Cranial nerve number 10, vagus nerve, goes over the aorta here and down into the abdomen. Again, the aortic arch, you can see the brachiocephalic trunk, left common carotid, and left subclavian. The brachiocephalic trunk branches into the right common carotid and the right subclavian. Pulmonary trunk, right here, pulmonary artery, aortic trunk, superior vena cava, and this back here is the trachea. Again, we have the right atrium with the right auricle. The right ventricle is this area. The left ventricle on this model is missing the wall, so you can see into the center, which again shows pectinate muscle, papillary muscle, chordae tendineae, and this is the bicuspid valve going from the left atrium to the left ventricle. This is the aortic semilunar valve going out into the aorta. Alright, again, this is the right atrium. We can see the superior vena cava and the inferior vena cava entering the heart. This opening right here is the opening of the coronary sinus, and this depression right here is the fossa ovale. This is the tricuspid valve, or the right atrioventricular valve.